Imagine you walk into my pharmacy and list out your symptoms. Doctor, I have pain. I feel like a hot human lava lamp and my throat hurts. And I hand you some pills that are painkillers. It's written on it Ibuprofen, which is an NSAID. You take it and feel amazing. Your symptoms are gone and you're recovering. Before I started studying, I found it fascinating how the pill knew exactly where my pain was. Well, honestly, that was a silly question, but still nonetheless important. I found the truth to be that the pill doesn't actually find the pain, it just spreads throughout the body and does its job. Now that I'm a pharmacy student, I find it more fascinating how the drug actually works on a molecular level, and I will explain everything because it's truly amazing how a simple pill works and it makes you feel amazing. Hey, I'm Dr. Magnum, a second year pharmacy student. I made this channel to talk about science, medicine, and healthcare. As I'm learning and progressing and I'm learning all these new things, I love to discuss and share my knowledge. So please support me on this journey by watching my videos, liking, subscribing, all that thing, and donating. Thank you, everyone. In this video, I will talk about what NSAIDs are. The painkiller that I just gave it to you or belong to a class called NSAIDs. The buzzword inflammation. What is actually inflammation? Because it's related to pain and we need to understand how NSAIDs work. We need to understand how inflammation works, how NSAIDs work, therapeutic use of NSAIDs, why we use NSAIDs, and also what can go wrong when you're taking NSAIDs. NSAIDs stand for non-steroidal anti-inflammatory drugs. These drugs are anti-inflammatory, so they reduce inflammation, and the inflammation is associated with all the nasty symptoms that we are trying to basically target. Before I even talk about what NSAIDs are, I need to first explain what inflammation is. So what is inflammation? The fancy buzzword of the health gurus of the internet. I genuinely only figured out what inflammation was when my immunology professor asked me, what is inflammation? And I so confidently raised my hand because I thought, I knew what inflammation is because of social media. I only left my professor undelivered. I didn't know what it was, but as I studied and I learned, it's basically simply your body's response in cases of infection and tissue damage. Your body is waving a giant red flag in the form of inflammation when you get infection and tissue damage, so your body recovers and resolves the issue. What is the scientific molecular level detail of inflammation? Here comes a molecule that initiates and triggers this inflammation called prostaglandin. Prostaglandin triggers the inflammation process and makes inflammation. Prostaglandins are fascinating because it has many vital roles in the body and is also in inflammation. There's two cyclooxygenase enzyme that produces prostaglandins. I know you will forget that long name, so for short, it's called COX. Get your mind out of the gutter, you dirty. And based on the COX prostaglandin, the prostaglandin does various roles in the body. There are two types of COX enzymes, COX-1 and COX-2. COX-1 is like your body's maintenance crew. It's always there, it's always available, and is important for many of your body's vital functions. For example, like your stomach's mucosal lining to stay intact and protected from the gastric acid, your kidney to function properly, your platelets to aggregate when needed. We also have COX-2, which is only available in emergency situations. It's only called upon into action during inflammation, and it's responsible for raising your body temperature to cause fever, widening your blood vessel vasodilation to improve blood flow to the injured area, and that's where the swelling and redness comes from, and also driving inflammation to get immune cells to the site of injury. COX makes prostaglandins, and prostaglandins cause inflammation, which causes redness, swelling, and pain. The reason I talked about inflammation so much is so that now that we know how inflammation really works, it's really easy to understand how NSAIDs work. After you've taken the pill I have given you, the drug enters your body and is distributed throughout the body because of the blood vessel, and it reaches the area of pain and inflammation. Your body produced prostaglandins and triggered inflammation. So how does this pill stop inflammation? Well, simply, NSAIDs stop prostaglandins, which, is a molecule that causes inflammation, from forming by blocking the COX enzyme. You remember that, huh? COX enzymes turn arachidonic acid into prostaglandins. NSAIDs bind to the COX enzyme and prevent that conversion. There are some different examples of NSAIDs. Some of them are OTC, over-the-counter drugs, which you can get from my pharmacy for your pain, fever, and flu. Others are much stronger and are prescribed by the doctor, and you should be taking this medication with prescription. Also, there's two variants of NSAIDs, non-selective and COX-2 selective, which only targets the COX-2 and therefore has less side effects. The examples of NSAIDs are aspirin, ibuprofen, naproxen, diclofenac, and itracoxib. And NSAIDs have these actions. They relieve pain, they reduce inflammation, and they reduce fever. So let's talk about some practical uses of NSAIDs. What are NSAIDs used for? Because they are analgesic, therapeutic, and they're also anti-inflammatory. What are they used for? NSAIDs are used for muscle ache and headaches, types of pain. They're used in painful periods. They're used in sprains and strains. For example, you got injured in a sport. They're used for colds and flu because the virus causes more inflammation. Also arthritis, which is the inflammation of the ligaments and the joints. And we especially use the stronger types of NSAIDs in these situations. Any other class of drug, the dose makes the poison. And there can be certain adverse effects and interactions or things that could go wrong when you're taking NSAIDs. This is not medical advice, this is just for educational purposes. Really, the main idea is that it really comes from the shutdown of prostaglandin, which is vital in various body functions, like for example, gastric adverse effects, renal adverse effects, cardiovascular adverse effects, hepatic adverse effects, especially in NSAID toxicity. Let's talk about gastric adverse effects. Ulcers can form because the gastric acid is neutralized by the gastric mucosa secretions. COX-1 is responsible for the production of prostaglandins, which activate the gastric mucosa to secrete substances that neutralizes the gastric acid. When this gastric mucosa secretion is not being secreted, the gastric acid damages our own cell and causes ulcers. COX-2 selective NSAIDs are a better option for lower risk of this adverse effect because they don't target the COX-1, which is responsible for the gastric mucosal secretions. Another adverse effect we should talk about is the renal adverse effect. Prostaglandins have a role in managing renal function and hemodynamics. The blood is filtered by the kidney, and in patients with renal dysfunction, prostaglandin is vital for renal function. Therefore, they need to be more careful when taking NSAIDs. NSAIDs are truly fascinating. Now in the comments, please write what you find interesting about NSAIDs. Donate because I'm a broke student and I'm trying to make these videos. Thank you for everyone for watching, and until next time.